Thank you all very much for taking the time. My name is Jason Finch. I'm a Program Support Manager at Transaid. Transaid is an international development organization with two core aims. For the past 27 years, we've been working predominantly across sub-Saharan Africa to reduce preventable serious injury and loss of life on our roads, while at the same time, we also work to improve access to healthcare by strengthening transport systems, helping hard-to-reach communities and underserved populations access these services that they need. And today I have the pleasure of presenting a project that brings together those two core aims. Completed earlier this year, Madereva Salama Zaidi, or Safer Roads, was a 7-month initiative designed to improve the safety, health, and overall well-being of long-distance drivers and the communities that they interact with. Joining me today, delighted to have my colleague, Henry Mwaziga, Programs Manager at North Star Alliance. North Star provides healthcare services to mobile populations and roadside communities through their distinctive blue box clinics, currently operating in 10 countries across East and Southern Africa. I'd also like to extend apologies on behalf of our colleagues at the Kenyan Transporters Association who couldn't join us today, but are nonetheless an essential part of the delivery team. And before we crack on, I think only fitting on behalf of all this team, to give thanks to the Lloyd's Register Foundation and the Gibbs and Morrell Trusts in the UK who kindly supported this initiative. Next slide, please. So to start with, a bit of location scene setting. Mombasa Port is one of the largest and busiest shipping ports in the region. It anchors the Northern Corridor, which is a major trunk route which runs east to west across Kenya and beyond into 6 countries, has a total length of about 2,500 kilometers. Needless to say, the corridor is a critical transit route for goods and services, and traffic is only growing, which is mounting pressure on existing infrastructure. In 2020, the National Transport and Safety Authority in Kenya reported a 64% increase in road crash fatalities in Kenya alone, just along that corridor, and that's across all road users. This, of course, is what Transaid is working to reduce. And we do this by educating and upskilling the commercial driver workforce, both freight and passenger, often in collaboration with governments, to develop and deploy training standards and build training capacity. And throughout, we have long championed the link between driver health, well-being, and safer roads. And this is a cause, of course, shared by North Star Alliance. At this point, I will hand over to Henry, who will talk a little bit more about the driver workforce, their vulnerabilities, and some of the challenges that they encounter. Over to you, Henry.
Thank you, Jason. Good morning, good afternoon, and good evening to everyone joining us from across the globe. Once again, thank you for joining us. And thank you, Jason, for setting the pace to this important webinar. As you have mentioned, my name is Henry Mwazige, Programs Manager at North Star Alliance. Now, just speaking from where Jason left, we understand and we know that drivers, as they go about their daily duties of transporting cargo and people from one point to another, they face numerous challenges related to both health and also road safety. Not limited to the ones highlighted. However, these drivers face long periods away from their homes, weeks to months away from their families, creating social isolation and also psychological stress. This extended separation strains relationships and support system, which are crucial for mental health well-being. And without adequate support, emotional toll contributes to increased depression and also anxiety and coping mechanisms, therefore, to substances like drug abuse and the rest. These drivers as well, they experience poor rest cycles and prolonged fatigue, where irregular delivery schedules force these drivers to work throughout tight schedules, disrupting their circadian rhythms, and the pressure to meet strict deadlines leads to cutting sleep short, accumulating sleep debt, and also leading to chronic fatigue, which impairs their reaction to time, decision making, and also increases their risks of accident up to 4 times. These drivers as well have an elevated risks of non-communicable diseases and also communicable diseases. And for non-communicable diseases, they are fueled by nature of driving, which increases their risks to diseases such as obesity, cardiovascular diseases, and also diabetes. We also see at times stress hormones from tight schedules and challenging road conditions elevate their blood pressure at some point, and many drivers go undiagnosed for years due to lack of routine and structured medical checkups. On to communicable diseases, these drivers are vulnerable, having an elevated risks to diseases such as HIV and AIDS, fueled by extended time away from home and access to transactional sex at the truck stops and across countries, diseases such as tuberculosis and other upper respiratory tract infection due to pollution across the corridor, sexually transmitted infection, and also emerging epidemics such as mpox, which currently has left a number of drivers and also corridor community infected across different countries in the eastern part of Africa. The drivers have limited access to quality care. We have Ministry of Health systems which do not favor the mobile population due to its proximity to the corridor. Tight schedules have limited time for adherence to medical appointments. Healthcare costs, creating financial barriers for drivers with irregular income, where most do not even have long-term contracts but are engaged casually based on the need. And this is also fueled by cross-border health service fragmentation, where we see lack of systemized continuity of care across countries where these drivers operate. Now, this is where North Star Alliance comes in. A registered organization which operates and continues to establish a network of strategically located roadside clinics known as Blue Box, as Jason had mentioned. They are customized from shipping containers located along the major transport corridor and border crossings in Eastern and Southern Africa, as you can see from the map there. And what we normally do as North Star Alliance is to offer a practical low barrier and low cost response to transmission of communicable and screening and management of non-communicable diseases to these drivers, and not only drivers, but also workers on transit and also corridor community who are associated with the drivers. On to the road safety, some of the challenges the drivers undergo: lack of formal training early into the career, where we see most drivers basically lack critical road safety skills. They have limited structured refresher road safety education, mostly just renew their driving license and not really adhering to structured refresher course where it leads to complacency and definitely issues to do with road safety. We are in times whereby drivers value experience over training, considering probably and sometimes where a 10 or 15-year driving experience at times is seen better than formal structured training. With lack of culture to recognize on skills gap and risky behavior, this one even poses a greater concern. Additionally, drivers are so reluctant to take time away from work. Why? We are in an industry where pay is tied to the number of cargo trips made or the number of trips that are made. Family financial pressures prioritize immediate earnings. Again, fear of losing work to other drivers who are so ready and willing to push longer make these drivers to overwork and therefore increasing road safety. All of these and more are challenges that these drivers face, which significantly impact both their health and road safety. And these are precisely the issues that the project sought to address. Thank you so much for listening through. I'll hand over it back to Jason for the next slides, and I'll be back soon with more enlightening content on the results. Back to you, Jason.
Thanks so much, Henry. One of the, what we've come to understand from our experience with Transaid and what Henry has just really clearly articulated there is that one of the constraints that drivers face as constraints and pressures is time, and that time pressure is ultimately a detriment to safety and well-being. Drivers miss out on information and education, and in the health terms, that would include diagnosis and treatment. And what we have found to be effective, both Transaid and North Star, is to take the resources that drivers need to the places where drivers converge. And that's typically lorry parks, rest stops, border crossings. And it's there that we can deliver the sometimes critical information and promote positive health-seeking behaviors. And a really good example of this was the first year of COVID-19. And for the most part, governments were relatively quick in adopting WHO precautions, disseminating that advice, implementing protocols aimed at curbing the spread of the virus. Truck drivers, however, became famous because as a mobile population, they were often missed by this key information, and they continued to work. And it wasn't long before we saw transmission vectors align with major transport corridors. And our response during COVID-19 was to take that messaging from the governments, from the Ministry of Health, along with the PPE, to the drivers, to the rest stops and the border crossings. And for this project, we had a similar approach. As a team, we decided on the messaging that we wanted to promote, and then we produced two fact sheets, the first promoting HIV testing, treatment, and other cargo. Testing and treatment, and the other one was a cargo security checklist. Both were produced in English and Swahili. And also we did a run of stickers as well, which could be directly attached to the cab. So North Star clinicians, the wellness team, were going out to the lorry parks, handing out this messaging, and along with a rapid spoken sensitization that they were imparting. And before we started the campaign, we worked with a Mombasa-based haulier who had their own cargo security SOPs, and we delivered a training together to North Star clinicians just to make sure that they were able to speak on the topic with some familiarity and confidence. Next slide, please. Our overall aim with this project was not only to get that messaging out there, but also to promote the services offered by North Star Alliance and to increase the footfall at those roadside wellness centres. Services, as Henry has mentioned, include screenings and treatments for communicable diseases such as HIV and TB, and non-communicable diseases, cardiovascular disorders, and also drug and alcohol addiction counselling. And it's while the clinicians were out in the lorry parks promoting these services, do we have that interaction with the drivers, and do we hear from the drivers directly about their needs and their concerns and their worries? And this is a very natural part of North Star's work because they're all health professionals. This is they are trained to have these discussions and to recognize where people may have some health concerns and have those questions with them. And it was on one of these occasions that we started to hear that drivers were requesting glasses. And it is a remarkable consideration to think that drivers may be operating a heavy goods vehicle, trailer or truck, without correctional lenses. And this is very easy for me to understand. As a glasses wearer, I cannot walk through an open door without my glasses, let alone operate a vehicle. And so we took this concern to the Kenyan Transporters Association, the largest body of its kind in Kenya. And they said, yeah, we hear this frequently from our members. So much so that only a few months prior, the association had hosted their own one-day pop-up to invite drivers to come, be assessed, and if needed, they would leave with glasses. And this was great because we had, with them having such recent experience doing this, they were able to advise us on what was needed, how it might function, and the kind of demand that we could anticipate. And as a team, we agreed that we were well positioned, we were informed, and that we could respond to this need, and we could do so quickly. And in the same way that we were promoting healthcare services and overcoming those barriers by bringing those services to the roadside, we would, in addition, bring the assessment, diagnosis, and treatment for those in need of correctional lenses. And we were fortunate to secure further support from two UK trusts to be able to do this. And what we did was we just mounted a bolt-on activity to the original project within the framework, and we were able to deliver both simultaneously without disrupting either of those timelines. We brought into the team additional expertise. We partnered with an outfit called Dot Glasses, a Kenyan-based organization that specializes in easy-to-assemble eyewear for mobile and underserved populations. And the genius of Dot's approach is that the eye assessments, both sight and health, can be carried out in the community. And where corrective lenses are needed, they can be clipped together from sets in minutes. It's really fantastic. Dot provided training to North Star to carry out the assessments, fit the glasses, but also importantly, to recognize any eye health concerns which may need further assessment. And then those patients were referred to a specialist in the city. And now I'm going to pass back to Henry, who can share some of the results with us.
Thank you again, Jason, for highlighting the approach that we used and directly into the results, an impressive number. So we can see helping 1,795 drivers were engaged through in-person sensitization. This really enhanced trust in the population that we know it's often skeptical on health interventions. And the interactive sessions that were experienced during this period allowed the drivers to freely ask questions specific to what message that we are delivering that time and also other concerns that they had. The approach embraced what we call the power of peer-to-peer influence, where we use peer educators from the drivers community, from the population that we are targeting, who are sensitized on road safety, who are experts in terms of delivering health-related messaging to lead this drive and the initiative. And this created some safe space for the drivers to discuss health initiatives or health issues without stigma. Most interestingly, they were embracing the discussions around road safety coming from peer educators who are also well sensitized on the issue. And we also can see we had more than 4,000 digital fact sheets distributed digitally and through WhatsApp. And this was courtesy of Kenya Transporters Association Network, a platform used for day-to-day communications, leveraging mobile technology drivers already use for communication. So this one also ensured that the fact sheets were well delivered to drivers and they could review them, they could go through them even during their downtime at truck stops and anywhere they were at any given point in time. This shows the impact that the initiative really brought up in terms of reaching the target population with both or integrated information on health and also road safety. Next slide, please. So as we, before inception of this important project, we conducted a baseline survey just to try and monitor the number of clinic attendance before the project. And one of the factors or one of the things that we were really considerate is to how best do we use this opportunity to even ensure increased clinic attendance to the target population of the drivers that we are targeting. Impressive to see that we saw 104 to 108% footfall increase to clinic attendance. And this one is to the North Star Alliance Wellness Centers in Mombasa, both in Jomvu and in Kipevu, where that number represented or reflected more than double of the baseline results that we conducted before the inception. It demonstrated successful increased uptake of services, which we were aiming at delivering to this target population. And this indicated that drivers were moving not only on awareness, but they are moving from awareness to action on their health. The aspect of them attending the wellness centers showed that they were willing to really take action of their health into their own hands. And this also was fueled by the clinical services that North Star Alliance provide. Why? Because they meet actual driver needs in relation to what? Timing, location, and also the relevance of these services as required by the driver. We saw an increased screening of both communicable and non-communicable diseases as a result of the increased clinic attendance. Next slide. Out of the screening that we conducted, we are screening for non-communicable diseases and also communicable diseases, and specifically for non-communicable diseases, we conducted comprehensive health checks, which included blood pressure, blood glucose, body mass index, and etc., where a number of drivers received impressively first ever health screening. Why? It enhanced early detection of conditions such as diabetes and hypertension. And it's important because it came in promptly before complications develop. The screening results we see were linked to counseling as well on lifestyle modification and identification of high-risk individuals who also needed medical referral and follow-up. Screening also identified drivers who had undiagnosed conditions that increase their vulnerability to now communicable diseases. This was a very, very important aspect because, as I had mentioned earlier, the drivers are at elevated risk of such diseases due to their nature of their work. Next slide. Jason had mentioned that we were not only looking at screening for communicable and non-communicable diseases. Additional to the results on the previous slide is that we also screened for HIV. We also screened for TB. We also screened for STI. It was an integrated and comprehensive services that were being offered to the truckers. Additionally, we had 698 drivers who were cancelled on drug and alcohol addiction. One of the key indicators when it comes to the drivers managing some of the stressful condition is falling into the drug and substance abuse. And it's a coping mechanism for stress, loneliness, and fatigue. But dramatically, it also increases risks to accidents. Alcohol consumption during downtime affects the next day driving performance. Addressing addiction, then therefore, it was aiming at improving road safety for drivers, and not only drivers, but also other road users, where some sessions identified underlying mental health issues requiring additional support and referral. And we were working closely with the Ministry of Health, where we had mental health counselors who really supported those that were being referred to. Next slide. An interesting component of this project, and Jason had mentioned vision and eye health assessments, where 4,107 drivers were screened for vision and eye health conditions. We all know that vision is a fundamental component to safe driving. Yet, we realize that many drivers operated with undiagnosed vision problems. Our staffs were well trained by dot glasses, and the trained clinical staff conducted assessments which included visual acuity, peripheral vision, depth perception, and others. Notably, long hours of focus on the road combined with dust, glare, and UV exposures are seen to as factors that damage the eye health of these drivers. And many drivers don't realize a gradual visual decline. They tend to adapt without knowing that actually they are impaired. Undiagnosed conditions found during this particular screening included, and not limited to, refractive errors such as nearsightedness, farsightedness, astigmatism. Interestingly, some even had mild cataract and even glaucoma, diabetic retinopathy. These are very serious conditions. If not early diagnosed, then cause big problems as they continue with their duties of the work. And poor visions, what does that mean? Missed road signs, misjudged distances, delayed hazard recognition, which all of them lead to increased risk of road accidents. And eye health was integrated into overall health screening and assessment. It wasn't an isolated intervention, and therefore it impacted heavily on the uptake of other services as well, which these drivers are at risk of, and with services which they are need for them to reduce the risks that they face. Next slide. Out of the truck drivers who were screened, 971 had customized glasses fitted, which was an impressive outcome. And it was immediate, tangible intervention that drivers experience as life-changing. And these custom fit glasses ensure that they're comfortable for long hours and they can wear at any given time. Some of the feedback that we received in the course of implementation is that they were able to now see clear road signs. There was reduced eye strain, reduced headache, better night driving confidence, and many drivers who we were able to interact with were quite emotional about the improvement. What they were acknowledging is that glasses represent care and dignity that they thought they wouldn't enjoy for a long time. It alluded to the fact that vision correction reduces accidents It protects the driver's health, prevents injury not only to the drivers but other road users as well. Next slide. And as we are doing that, we acknowledge that we were not, or the clinical team was not able to manage all the conditions that were actually diagnosed at that time. And that's why during that reporting period, we had 110 referrals to eye health specialists. And some of these conditions were beyond scope of primary screening and required specialized care. Conditions like mild cataract and glaucoma needs pressure management, retinal problems were initiated, and referrals were made. And we know that cataracts are particularly concerning. It can lead to progressive vision loss, we know, and that can end driving career if left untreated. Glaucoma, for example, nicknamed silent thief of sight, it causes irreversible damage without symptoms until advanced. And so this was a very important initiative to ensure that even the conditions that were not addressed on site, they were referred for specialized clinic. This demonstrated the project's comprehensive approach, not just screening, but ensuring that the truckers, the drivers we interacted with during these sessions receive needed treatment. Additionally, just to appreciate that this initiative addressed the increasing road traffic accident, I'll say, along the Northern Corridor. Why? Because we were addressing road causes, road safety, drivers' health, both non-communicable and communicable diseases, fatigue and vision impairment, and having discussion with drivers in relation to how then do they ensure a healthy corridor as they do along their duties. And it's important to know that long distance drivers as well are epidemiologically significant as mobile population who can amplify disease transmission across border into communities. We see HIV prevalence that is more 2 to 4 times higher than the general population. TB, malaria, and STI follow similar patterns as well. And without intervention, drivers become victims and unintentional vectors of our disease. This project led to addressing these issues, the communicable and uncommunicable diseases, and together recognizing what we are calling the interconnectedness or connections transmission, while addressing the issues around road safety and the driver well-being. Again, we saw that by reaching the drivers, this project, not just the population, but their families as well, their communities along the roads, and also other road users were equally impacted as we were reaching these drivers. What we know is healthy drivers drive safely. Drivers who know their status and receive treatment do not transmit diseases, and this multiplies impact exponentially across the Northern Corridor. And at long last, we have a thriving Northern Corridor or a thriving transport corridor once we have drivers who can deliver goods and people safely. Thank you so much for listening to me. I will now hand it over back to Jason.
Thanks so much, Henry, for sharing those results. And we were so pleased to achieve the numbers that we got. More than doubling the footfall in both of the Blue Box clinics was just absolutely fantastic. And we'd originally aimed, we had thought we would get to 2,000 eye assessments, and we did more than 4,000. And it's just hugely impressive that the North Star Alliance team were able to absorb and service that demand, and that the footfall still remains large in both of those wellness centres, just showing you then that the impact lasts beyond the initial implementation. It just shows the strength and the value of being able to refresh and bring new content into your messaging, and with that messaging, mobilize a team to go out into the parks, the lorry parks, and engage with the drivers and remind them that these vital services are there for them and they're available. Almost the last hurdle that you have to overcome is that short walk from the truck cab in the lorry park to the wellness center. And in Jongvu, we're talking a distance of about 50 meters. I had the pleasure of visiting both clinics during these activities and meeting with some of the drivers. And, just as Henry was saying, it was just remarkable how immediate and dramatic, the change was for them to have corrective lenses for the first time. Or maybe replacing a lost pair. And that impact too was witnessed by the North Star Alliance team. And I put a quote here on the screen from Asha, who is working at the Jomvu Wellness Center, and she's talking about how much fun it is to, you know, to watch the drivers sort of take in the world around them for the first time in a bit of a sharper, crisper form. And and it's important to stress that not all the glasses were for distance. A good number of the prescriptions filled were for nearsighted tasks, but those that needed them for distance, Asha would tell me, would walk out of the gates at the front of the wellness center and just peer up and down the roads, removing the glasses and putting them back on. And that gentleman to her right just sat there, did exactly that in front of us, and it was it was really fantastic to see. Next slide, please. And that brings us to our conclusion. And I think I'd just like to wrap up by saying that it's really difficult to exaggerate the value of talking with the communities that you intend to serve and listening to them, working out what their problems are. We are we're a complex people, and our needs and desires they change. And it sounds obvious, but it's not always the case. And I think it's to our benefit at Transaid that we practice designing into our programs a degree of flexibility, and then we retain an ability, I believe, to respond and pivot. Because when while you're out there, you must be in a position to learn and to absorb that information and to respond for it. And I think it's also really important to stress that when you do learn that information, that you've got to, as a team, have an honest conversation whether or not you are in a position to respond with quality and effective. And if not, then build your team up and bring in the expertise that you need to make sure that you do a good job. At Transaid, knowledge sharing is a huge part of our culture. And if you use the QR code, point your device at the QR thing on the screen now, that'll take you to our knowledge center where you can download the resources that we've mentioned today. So that's the fact sheets. We've got 2 fantastic case studies on there, and there's also a technical brief with a little bit more detail about this project. I just want to say my thanks again to all of the North Star team. It was a real privilege, and it was fantastic to work with you. And there's a big team there, and it's I know that we haven't highlighted everybody in the slides today. Thanks also to the Kenyan Transporters Association, who endorsed the project, gave us allowed us to brand it, and that's hugely valuable, in a world of constant disinformation. And again, to Dot Glasses, who just happened to have the solution that we needed to fix the problem. And such has been the interest in the project recently, and I think it really resonates with a lot of people. It's quite an easy one to understand. I'm delighted to announce that in the last week we've been able to commit funds to a scale up of this intervention. And the beauty of this is that we've got our clinicians are trained, the North Star clinicians are trained. The vision assessment kits are already at the health clinics. So those funds will be going directly into more glasses. And what I'd like to do is encourage people to consider engaging with the project, because further support will just result in more glasses for drivers and for the roadside residents. Please do get in touch with me if you'd like any more information. My email is on the screen, or you can reach me through the website. It will get to me eventually. And I think I just want to pass it back very quickly to Henry. I think you've signaled that you've just got one more thing to share with us before we move into the Q&A.
Great. Thank you. I thought probably I would share after Q&A. So I don't know whether we can just go ahead to Q&A. Then once we're done, I can share the information, or I can just proceed and share right away.
Okay, we have had questions come in on email this morning. Actually, Henry, let me start with you. So one of the questions that we got asked a lot is the Northern Corridor, and we've got, I think, 8 blue box clinics along the Northern Corridor. What was the decision for going with the Jomvu and Kipevu, the 2 that we did go with, out of all of the options that we had?
All right, thank you. I think one thing that I didn't mention is that North Star started way back in 2006, and in Kenya 2009, and visibility was done back then. And once it was done, mapping of the hotspots and mapping of the truck stops at that particular time, the counties that are harbored, and we can appreciate that the Northern Corridor begins from Mombasa, right from the gate of port, that is gate 18, then again Jomvu, which is a bit off the port and acts as one of the central truck stops. Once the cargo has been moved out of the port, most of them tend to be around that area as they sort out other logistics. And therefore, that stood as a bit more central in terms of the truckers, again, just before they begin their journey towards the transport corridor. So the setup of these centers was strategically positioned in either transit towns or port towns and also border towns. And that's why we have the centers along those areas and in counties specifically where truck drivers frequent as they transport the cargoes. However, as I mentioned, as I was talking about North Star, that we continue to establish because the network keeps on expanding and there are areas that we haven't been there, and therefore we are still having that opportunity, and it's a call as well, so that we are able to even expand to areas where now the truckers frequent, but we haven't really set up the wellness centers. As I mentioned, we set them up from customized transport. I mean, containers, 42 feet or 32 feet containers, and then we offer services to the truckers, drivers, and also workers on transit. Back to you, Jason.
Yeah, thanks, Henry. We also there's a question that's come in as well about how a driver is able to obtain licenses without having a vision check. I mean, we're probably most of us are familiar that it's an essential part of getting a vehicle license. This is something that we've encountered not just in Kenya, but in quite a few of the countries that we work in. And vision assessments are often prescribed, but the reality is that they've not always been thoroughly enforced, and particularly with drivers who are older, they might have gone and taken their license test, potentially decades ago, when perhaps the rules weren't as stringent. And also, vision does deteriorate, and some countries, I know particularly in Ghana, for instance, are now coming in, changing the rules, saying that commercial drivers need to go through periodic annual assessments to renew their licenses, which will include vision assessments. But we have a huge population, the driver workforce, that have entered into the career, into the job, stayed in the job, and they've missed out on going through these checks. Just very simply, just as they haven't been going into other healthcare services as well. So it's something that we're definitely seeing changing, but there is still a huge driver population out there that, as we found, that are in need of correctional lenses. And Henry, I'm just going to pass this one back to you because we were blown away by the numbers. We were really amazed. We got about 24% of those that we assessed did need glasses. Why is this such a widespread problem?
I think one thing I can allude to, Jason, is that over the period of time, we hadn't seen intentional screening of eyesight to these drivers. And it looked like that it's a problem that kept on accumulating. And there was no structured interventions that were geared towards them. And as we were coming in, then we realized that it is a problem that has accumulated over time. And there is no better time than this to actually try and start addressing the challenge and the problem. I can attest that these drivers are highly exposed to dust, pollution. They strain a lot, a long of hours are spent on the road trying to deliver cargo and people, and over time, they are exposed to issues to do with the eye safety. As I've mentioned, most of them don't really realize that they're having some issues around impairment or vision impairment until they are assessed, and that's when they are told you are having mild condition that needs to be addressed. And therefore, it's an opportunity to really, really dig deeper into this cause and continue sorting the problem, of course, calling to all other stakeholders to at least initiatively put our hands together to ensure that this is a corrective measure and reduce road safety, improve road safety and reduce risks of road accident thereafter. Back to you, Jason.
Thanks, Henry. I'm aware that we've only got a couple of minutes left, and Henry, I want to give you the last word as well. Just very quickly, that there has been a question about a research component in the program. We think that this is an urgent requirement, and we're going to hopefully collect the data from our pilot and with our scale up, and hopefully produce and disseminate that in some way. So I would say just to watch the space. Just before I hand it back to Henry, please do engage with our Knowledge Centre, do engage with our website. If you go onto our website, down at the bottom, you can pop your email in there to sign up to our newsletter, because as of, I would say, within the next 3 weeks, 3 or 4 weeks, we're going to have glasses going out. Project is going to be kicking off again. And we look forward to, taking you with us on that journey. So that's everything from me. I just want to pass it back to Henry to wrap up. Thank you, everybody.
Right. Thank you so much, Jason. And again, thank you so much, everyone, for joining us. Just before we leave, as North Star Alliance, last year we had our first annual conference, a regional conference. We realized that we have done a lot and we keep on doing a lot. However, we don't bring everybody on board to kind of share what we do and expand our levels in terms of engaging all the stakeholders to appreciate what goes into a healthy transport corridor. And yes, last year we had our first annual conference, and this year we're having our second regional conference on transport corridor and health. And this one is an interesting one that everybody needs to be part of. Looking at a very important theme, innovation and partnership for healthy and prosperous transport corridors. And again, borrowing a lot of lessons from our last conference, this one is even more interesting. Just a few of the sub-themes that are going into there, looking at, we're chatting on a pathway on sustainability, healthcare along the transport corridor, Africa corridor. How do we leverage technology, AI, and data to increase access to health and enable smarter trade? We're looking at disease surveillance and research. We're connecting the dots in terms of strengthening cross-border health and trade systems, empowering traders, building climate resilience corridor, and mental health, and among others. We are still registering, and I will really urge, let us visit our website. We have a concept note there, we have an information there. We have quite a number of interesting packages for different amounts, and we welcome, because it's a regional conference and everybody is welcome. So kindly visit our website and register to be part of this important initiative. Again, thank you so much for finding time to join us, and we look forward to continuous engagement and better transport corridor. Back to you, Jason.
Thank you so much, Henry, and thank you, everybody, for your time today. Goodbye.